All right, well, we will call the Health and Human Services meeting to order. Madam Clerk, roll call.
Commissioner Marecki.
Here.
Commissioner Dobb has requested an excuse. Commissioner Anderson. Commissioner Killeen.
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item, please.
D, Chairwoman's remarks.
I have none. Next item.
C, approval of the February 22nd, 2022 meeting minutes.
Madam Chair, I'll move their approval. Minutes.
Support.
It's been moved and supported. All those in favor?
All right.
Aye.
Any opposed? All right, motion passed. Next item.
D, unfinished business. There is none listed.
All right, next item.
Item 1, under new business, discussion with the Beaumont Government Relations Committee on the merger of the Beaumont and Spectrum Healthcare Systems.
All right, who do we have here from Beaumont? Mr.
Good morning. I'm Dave Clays. I'm the president of Beaumont, Dearborn, and Farmington Health Hospitals, and I'm the interim chief operating officer for Beaumont Health. So happy to join everybody today.
Thank you for joining us. You can go right ahead with your presentation.
Okay. It's just taking me a second here to bring it up. Can everybody see it okay?
Yeah.
Yes.
Okay. So I wanted to just give one, thank you for having me today. It's really exciting to be with all of you. You know, we're in such a big metropolitan area sometimes. It's really difficult to connect with everybody. We have a great government relations team with Jeff and Megan Petsko-Sweet who are on the phone with us. They really do a great job of keeping us on task. I thought what I would do today is share some information about Beaumont Health, about Beaumont Spectrum, and then give you some time to ask me any questions. I'm from my, working in Dearborn, as well as working out at the Troy Hospital. I'm super transparent. There's not a lot of secrets that we have. And, as a resource of the community, we take that very seriously. And we want to provide you with great information and work with all of you in a partnership to help provide better health and better care to the patients before they get to the hospital, but also when they go home from the hospital. That's super important to us. So a little bit about Beaumont Health. We're 8 large campuses, and I know when we think of campuses, we have such big hospitals around us that we don't think of our smallest hospital, which is 100 beds at Wayne, as a very big hospital. In essence, it's still around the 50th percentile for hospitals in the country. Then we have obviously Royal Oak, which is just a behemoth at 1,100 beds and actually one of the largest hospitals in the entire country. So we're a really big health system with big hospitals serving really great communities. We have about 170 outpatient locations. We have about 3,400 beds. Now this will change. This actually goes up to about 3,600 beds as we have softly opened up the 9th hospital, which is our behavioral health hospital over on Rotunda off the Southfield Freeway. We are waiting to get certified from the Centers of Medicare and Medicaid in the state of Michigan on that. Once we're fully credentialed, we'll begin to open that up more. So it's kind of what we call a soft opening right now. Obviously we have about 38,000 employees here, about 5,000 physicians that we work with. We have about $4.7 billion in net revenue. The great thing about being a nonprofit is we like to pile a big chunk of that, about $200 to $300 million back into capital projects, whether that be a new hospital or needed equipment that we have. And we have about 577,000 emergency room visits. We added the urgent cares a few years ago as a cheaper, better access way to get people to cheaper, better access to healthcare. I will tell you last year in 2022 or 2021, I apologize, we have seen about 600,000 patients in the urgent care. And we have seen less people in the emergency room. So hopefully that's good. That's a good cost savings, hopefully for people who can't get into their doctor yet, have access to good quality care. And then there can be a decision point. You're fine, go back to your primary care doctor, or nope, you're really sick, you need to go to an emergency room. And obviously we deliver over about 18,000 births a year at our hospital, something that we're really proud of. I think it's one of the great things that we do for the community in giving great care. This is kind of a legend of our acute care campuses. 5 of them reside in the county with Grosse Pointe, Taylor, Trenton, and Wayne, and the Dearborn Hospital. The stars are our urgent cares. We continue to add more and more of those because we think that those are better access points to individuals who may not have good, who may not be able to afford to go to the emergency room or are unsure, can't get into their doctor's offices. So to prevent them from going to the emergency room, we really want them to use an urgent care, which hopefully is quick and fully functional with that same high level of quality care that you guys have grown to expect from us. You know, this is the Dearborn Hospital. Here, I call it in the South region, really our big teaching hospital. It's 632 beds. We have 100 residents there, a couple hundred visiting medical students from the local universities. We provide a full complement of care, whether that's stroke, cancer, heart and vascular, orthopedics. We do a full range of everything here and really are the big referral center for the other 3 or 4 hospitals in the immediate area. We do have a large pediatric unit that we utilize here to help take care of peds also. And then obviously when people get really sick or need that quaternary care, we often, if it was a burn, a child who's really sick, somebody who needs a transplant, those individual patients would be things that we don't have at Dearborn. We transfer those out. This is Grosse Pointe. Grosse Pointe is a 280-bed hospital. It's growing every day as it takes on more and more advanced levels of care to be more of a referral center for that community in the northeast corner of Detroit. Something that we're proud of. The health system has really invested a ton here to bring this campus up to what I would say is our standard. And so we're really proud of that. We have the Taylor Hospital. I don't know if anyone has been there or not. Some of you may have. It's a beautiful campus. We've updated that campus too. We continue to expand orthopedics here. This is one of our hospitals that's kind of specialized in orthopedics as well as rehab services. It's a 180-bed hospital. That emergency room is growing quickly also. And we are looking at a large investment in redoing and potentially expanding that emergency room to handle more complex medical cases as that area has grown around the hospital. This is the Trenton Hospital. It's a 193-bed acute care campus. This is probably, as in totality, as our newest campus in Beaumont Health, minus the behavioral health hospital that we just built. It is about 10 years, 12 years old. There's the older part of the facility, I think, has been mostly renovated. Again, a level 2 trauma center with a full-fledged complement of heart and vascular services. And we are looking at recruiting some neurosurgeons down to this area, which is really important and key for the trauma program to make sure as we get those patients that come in with some type of head injury, that they have access to that care also. Very quick growing area. And then lastly, Wayne, our Wayne Hospital is a 100-bed hospital serving a key area. This is our designated hospital for the CDC. It's a level 2 CDC designated hospital, which means it can take the sickest of patients. So if a patient with Ebola, that's probably the most familiar one now that COVID has kind of calmed down. If a patient came in with COVID, this has a special unit in the hospital to handle those very sick infectious disease patients. Full complement of services here. This is a level 3 trauma center. And again, a 100-bed hospital serving that community. They just opened up our brand new breast imaging center and cancer services there. So we merged into Beaumont Health Spectrum Health, and that always gets everyone a little bit nervous, including myself. And when we did, actually, I think it's great because our hospitals, the Dearborn Hospital is as big as the Butterworth Hospital, and most of their hospitals, of their 14 hospitals, are under 50 beds. So as I travel in my travels to the other sites, you're all big hospitals now. There's not a big and a small anymore. We're all big. And so in the new health system, we actually become the largest employer in the state of Michigan with about 64,000 team members that we employ. We have about 300 plus ambulatory centers with a goal of really targeting and get access to care at the lowest level. Coming to the hospital should be the last resort and not what we want people to do. We have a new health plan with Priority Health. Beaumont will be, will own about 50% of that, and that'll help us. It has about 1.2 million health members right now. We'd like to see that grow because we think that's a great platform to help get people into our system and provide them great care and high quality at low cost. We have about 12,000 doctors that are either affiliated or on staff directly with the hospitals. 22 hospitals, this will get updated to 23 hospitals with the behavioral health hospital once it's fully licensed and credentialed. We have 15,000 nurses, and we've talked a lot. Some of you may have heard our challenges around getting access to qualified staff. And I know we spend a lot of time over the past month talking about how do we partner, how do we invest in our local universities. We hear a lot of times that there's a lot of applicants for roles and positions, but there's not enough educators to help educate them. So how do we help the local universities and colleges through that to get people educated? And there's a lot of them that want to advance in their careers and then get them jobs. And so we're very invested in that. And then I think a couple really big things, and I really appreciate that, spending most of my career as a clinician at Children's Hospital and at Sinai Grace Hospital. And that is investing. We're going to set aside each year about $100 million around healthcare equity. And I think when you serve in more underserved areas, I think you have a really clear understanding of that importance. And I totally get that. And this was probably one of the really great things with the synergies that we get around supply chain savings and all the big things at the corporate level. We're going to set aside that money. And then as well as setting aside some money to focus on technology, another $100 million. Technology has advanced so far. I think the pandemic has really forced us to move forward and think outside the box. Virtual visits now, video conferencing. We would have never thought about doing this, or we might have thought about doing it, but we did it poorly because the technology wasn't there. But now the technology is so advanced, so it's a really great opportunity for us to invest in this space and understand how do we get people better care, quicker access to care, right? They shouldn't necessarily have to go to a doctor's office. They should be able to telehealth to a doctor's office, or quicker access to care in their community to the right level of care that they need. So I'm really excited about us spending those or investing those $200 million there. And we don't have a lot of plans around it. I think those are going to start being developed, working with our community leaders, some of you such as yourself, and working with Jeff and Megan around our community team here to make sure that we're touching all those points in a comprehensive way. A few things, we talked about this for Michigan by Michigan. I think there's a lot of pressures on healthcare, and we feel that. And as we develop synergies by being bigger and technology advances and improves, hopefully that allows us as a nonprofit to invest more in our communities. We're very focused. I'm very proud to say that Tina Priest-Decker, our new CEO, is very focused on community engagement. And so what we've done at some of the sites, we started this at Farmington Hills, and we'll be spreading it out to other sites, is actually create a list with the local community leaders to define all the different projects and programs that we're involved in, whether that's supplying staff, supplying time and resources, or our ability to invest some money. We're looking at that in a very comprehensive way that it's coordinated. Seems to be more community needs for hours than we have people, but we have spread it across our entire leadership team. So at Farmington, that's about 78 people. In Dearborn, that'd be about 125 leaders that we're pushing to get involved in a multitude of levels in the community to help us be involved, to understand what are the needs. Our position in clinicians, they're super key. I know their time is super valuable. Right now, there's not enough of them, but to the extent we can get them out in the community, that's providing education, coming and being on a city council to provide guidance around COVID, or or whatever those issues are around the community health needs assessment, we're willing to do that. We really want to focus on exceptional care for all. And I think that's what the $100 million to me stands for. You're only as strong as our weakest link, meaning not weak as far as not being strong, but if we have an area of our communities that's not getting good access to healthcare, then we're not very good as a region or attractive as a state. And those areas seem to stand out. And we want to make sure that we're investing to bring up everyone's healthcare. We know there are dynamic challenges that everybody faces, but it's super important. And again, competitive value, and I'm proud that we're focused on high quality, low cost care. It's something that we've always been focused on Beaumont Health, and that will remain with Spectrum. And then we want to make sure the health system is positioned to thrive into the future. You know, healthcare, we used to think of always got a blank check. That does not happen anymore. We have challenges. I never thought I would see challenges like we have around our staffing, and that's at every level. It could be a nursing assistant. It could be somebody who works in dietary or EVS services, you know, through any clinical positions, nursing or our physicians. We're struggling with getting access to great qualified candidates. And I think the best way to improve that is working with our community leaders, as well as with the local education systems to help get access. We just, about 2 months ago, approved to go below the 18-year-old. We used to have a limit. You had to be over 18 years old to work in the health system, but what a great way to partner with maybe some high school students to get in and become a nursing assistant or a patient transporter, to get their eyes open, and then they also get some access to tuition reimbursement and helps provide them opportunities to grow in healthcare. And sometimes it's hard to see that if you're not involved in it. So I'm really excited about that. And with that, I will stop speaking and let you ask me any questions or any concerns that you have that I can. If not, we'll follow back up with you if I can't answer it today.
Well, thank you. Thank you so much, Mr. Clays, for your presentation today. I will take questions from any of the commissioners that have a question. And it looks like Vice Chair Commissioner Colleen has a question. Go right ahead.
Thank you, Madam Chair. Is it Mr. Clays? Is that your pronunciation?
Yeah, it's Clays, but you can call me Dave.
Okay. No problem, Mr. Clays. You're waiting on CMS to approve the new mental health hospital.
Yeah.
How many mental health beds do you have in the Beaumont system right now?
Yeah, we have 80 right now. I will tell you, not enough. We got special permission through the state of Michigan, which I really appreciate everyone's advocacy for, to increase that to about 160. My concern is, being very transparent with all of you, is we have those licenses, we have all the equipment, we have the beds, we know we have the patients out there, but do we have the staffing for it? We started a residency program around psychiatry at Dearborn this past year, but I will tell you, I don't know if that's enough behavioral health beds or not. Some people in the state say that it is. You know, in Metro Detroit, I don't feel like it is, but hopefully I answered your question. Sorry.
Yeah, it is not. As we stand here today, how many behavioral health beds, mental health beds does Spectrum have?
I think they have roughly the same number or slightly less. They may have 60 or 65. They have not made the investment yet in a behavioral health hospital like we have. I think that's the first one built, I think, that I can remember in quite some time, but yeah.
Well, I'm thinking about integrated health here, right? That's the future, ever more so. So if they have about 80, you have about 80, the state of Michigan has said, okay, go to 130, I think you said.
160, yep. At
160. So after the merger, if I'm doing the math right, 240 beds between the two of you?
Yeah.
And how much should CMS and all the regulators approve the mental health hospital?
Oh my goodness.
I'm sorry?
No, go ahead. I'm sorry. I didn't hear you.
Is that going to increase the number of beds, or are you just going to move people from other facilities there?
Yeah, once we get once the state signs off on the new hospital, all of its policies and practices, we'll begin ramping up with the additional beds that we'll get. And what we've struggled with is having the behavioral health a little bit fragmented at some of the different hospitals. What we've tried to do is centralize them in one location where we can have a multitude of the providers all in one location to provide an outpatient program, you know, a day treatment program for a week, and then obviously those inpatient services, pediatrics through geriatrics.
So when all is said and done and the hospital opens, behavioral health hospital, at that point, how many beds are you going to have in the Beaumont system?
Yeah, we'll have 160 beds, hopefully fully open by the fall of this year.
Okay, so it's just going to reflect what the state of Michigan has approved you for.
Yeah, our 78 or 80 and the 80 that they've given us, yeah.
Yeah. I agree with a lot of your assessment, staffing issues and that kind of stuff, but 160 beds is wholly inadequate. All the data will show you that. Okay, Madam Chair. Thank you, Mr. Clays. Thank you, Madam Chair.
Yeah.
I'm out.
Thank you. And to that point, is there a long-term care in the behavioral health? What's the longest that someone could stay on?
You know, we treat it much like a hospital. I'm not exactly sure on the time frame. And in the hospital, we've had people in the hospital for 6 months. Not that we want them there, but there's a barrier in some way. It could be their disease state or their illness, or it could be finding the appropriate place to place them. And so we'll hold patients in the hospital for a long time. I don't have a definitive answer. We can get a good average or an estimate for that. The campus that we built on Rotunda just for the group is, you know, we're gonna get it up, hopefully fully opened, ramping up for the next 6 months. But the site was built with the intent to be able to expand that hospital and go up to 300 beds to add another 140 beds. There's a process we have to go through with the state of Michigan and the CON, the Certificate of Need Commission, to do so. But we built the current site with that full focus of thinking that, what I think all of us feel anyways, is a need for a lot more of those types of beds. And so our plan is if when we need to be able to go up to 300 beds at that site.
Thank you. Commissioner Marecki.
Thank you, Madam Chair, and thank you, Dave, for the presentation. It was great, and I live in Livonia, so we're looking forward to the new outpatient center being opened up in April, I believe.
Yeah.
I have a question. With your physicians, are they owned, are the practices owned by the hospital or by corporate entities, or how does that work with?
Yeah, so in Beaumont Health, of our 4,700 physicians, there's about 1,200 that are employed by the Beaumont Medical Group.
Okay.
And the other, let me do the math, 3,500 are private. And so they're in a separate entity. They have their own governance. They reports up to the board of directors. They pay dues to be on staff at each location. They have to meet certain requirements around quality and safety and service in order to be on staff. As long as they meet those, they can join the hospital. There's a fee, so it gets expensive for them to be on a bunch of hospitals. But the private docs are their own private companies.
Okay. I remember, if I'm correct, I remember something about a couple years ago, there was something with the anesthesiologists. I don't know if a company came in and another company came in with them, and I was just wondering how that has worked out.
Yeah, we actually there's two different groups that were functioning around anesthesia. So we do contract for services. That's a great point. We do it in a couple different areas. In the South, we do it in the emergency room. There are a bunch of private doctors that we contract with called Team Health. For anesthesia in the South and the North, we contracted with the doctors. In the South, it was a group called A4, which is Ann Arbor Associates, Anesthesia Associates of Ann Arbor, A4. And they had termed their contract with us. They were bought by a private equity firm and they had terminated their contract with us. So in the South, we went ahead and we did an RFP process and we selected this group, North Star Anesthesia. They've done fantastic for us. And I will say when we've switched over these big services in the past with these new companies and some new docs coming in, some stay in transition, some leave. I have to compliment them. They really did an amazing job. I think where we heard a little bit of noise is the group that was there since I think the 1960s at Royal Oak Troy and Grosse Pointe switched over. They ended up switching over to North Star. Also, the health system decided to switch over with them. And I think there was just a little bit of frustration. They had some retirements, some new individuals, and there's a lot more noise. When we reviewed the quality data with the board of directors, we couldn't find any smoking guns that anybody had done anything wrong or that there was a quality or a safety issue. But in the world of social media, as we all know, and everybody gets to put their opinion out there. And so we've had to deal with that a little bit. I feel worse for the medical staff because they're doing fantastic right now that some of that has calmed down and really that we've kind of reviewed the facts a little bit more, kind of going forward. But yeah, and at Farmington Hills, we still have the legacy group that's there. What we've seen change a little bit, and I think it's something that we could all be aware of, it's a learning process for me, is private equity is now buying up a lot of the private doctors' practices. And that's okay, but sometimes I call it the honeymoon phase. When the honeymoon phase is over, sometimes the requirements of the job or how that works in that job are really difficult on them. And so we'll see how that works out going forward. It's a big trend in the country right now. Doesn't bother me, but I always worry about when things are so focused around money, but it's part of life right now. So we're
Sure. Okay. Well, thank you for that.
Yeah.
Presentation and the explanation. Appreciate it.
Yes, thank you. Any other questions from commissioners? All right. Well, thank you so much, Mr. Clays, for coming before us today with this presentation. And if we can assist you with anything, please feel free to reach out to us.
Thank you so much, everybody. Have a wonderful day.
Thank you. Thank you.
Bye.
All right, Madam Clerk, next item, please.
Item 2, requesting commission approval of Amendment 2 to a contract with the 1-year option to renew with Global Vision Technologies.
All right. We have someone to talk to this item. We'll take this item, and then we have another addenda item that we'll take all at one time.
Sure.
Through the chair, it's Jennifer Caruso, Division Director. Good afternoon.
Good afternoon.
This item is an upgrade to our current adult case management system that allows us to better track vendor data for the Adult Community Corrections Program. It also allows us to create invoices to bill vendors for the services performed.
Okay. Any questions from commissioners about this item? Commissioner Colleen, Vice Chair.
Thank you, Madam Chair. Director Caruso, is this a result of an audit? Was that a recommendation come from an audit to add this?
No, it is not.
Okay. All right. All right. Thank you. That's all I got.
Welcome.
All right. Any other questions from commissioners? Thank you, Ms. Caruso. Next item.
Item 3, requesting commission approval of Amendment 2 to a 5-year professional services contract with Southeastern Michigan Health Association. And for the record, it is Amendment 2. It says Amendment 1, but that is an error and it will be corrected for full board.
Thank you. All right, any questions about this? Actually, let's have someone talk to this item, please.
Madam Chair, my name is Carolyn Baker, and I'll be speaking to this item. First and foremost, I want to thank you and the Vice Chair, Commissioner Killeen, and the members of the Commissioner for allowing this contract to be reviewed today. And I also want to give a special thank you to the Commission staff that diligently worked on this and collaborated with us. And we're truly grateful for their hard work and working together with us. This is our department, the Department of Health, Human and Veteran Services, specifically our Public Health Division, is requesting approval of Amendment 2. This is an agreement between Wayne County and the Southeastern Michigan Health Association, SEMHA. Under this agreement, we are increasing support and execution for staffing that support COVID-19 response activity that relates to testing, contract tracing, case management, as well as vaccine administration. This amendment increases our funding by $12,257,121. And it increases the amount of the contract from $37,559,147 to $49,816,268. This is the contract is for 5 years. The terms remains the same, and we're just asking for approval to expand our activities around our COVID response.
All right, thank you. Are there any questions from commissioners? Vice Chair Killeen.
Oh, go ahead.
You bet, Madam Chair. Thank you very much. Ms. Baker, we're up to $50 million now in contracting with SEMHA. And I think all of that is to provide staffing for the county.
That is correct.
With this, are any of our current employees being displaced in favor of SEMHA as a result of this?
No. This is not in conflict with our current employee, and we are and have been diligent in ensuring that we are assessing these rules to ensure that no one is displaced. So no.
Okay. Was there any analysis of, instead of paying SEMHA, to hire more county employees to do this?
Well, the analysis is we have county employees that support this effort as well. They're working along with SEMHA staffing to be able to deploy quickly and flexibly. So we always analyze whether this is something that we can bring on or see if there's a county employee that is able to take it on. However, we work in tandem. We work together, and our management, our staff, our supervisory staff are county employees, and they are, working along with the SEMHA staff to move our operations forward.
Yeah. It's a long-standing discussion in the county, Ms. Baker, when it comes to SEMHA. Can you share your analysis of why it's better to go with SEMHA than it is to hire new employees? I would like to see that as a policymaker, to see how we get to, and of course, I'm going to use the language outsourcing jobs instead of having them in-house. Is it possible for you to share that now? I mean, I'm good with numbers, right? And I understand our budgetary situation in the county.
That's right.
But seeing the numbers and seeing that analysis, because the more we use SEMHA, the longer this discussion that we're having now is going to go on. And I could be it could help me a lot to see the analysis behind why we're going to SEMHA and why we're not hiring new employees in the county to do this.
And certainly I would definitely work with the public health team to share this analysis with you, but I just want to share this with you as well. I've been in local government for a very long time in public health, in the city of Detroit, here in the county. Southeast Michigan Health Association works with public health departments in this way. It gives us an opportunity to be able to continue our operation to serve our residents, especially when there's short-term funding and we are unsure if the funding is going to be sustained from year to year, to disrupt civil service, to move them into a position and then have to figure out how that funding is going to be. So it's really a strategy, you know, of how we are able to deploy our services with the least disruption to our operations and support our residents. And we're always assessing that. And this is an issue that is dealt with public health departments throughout the state and here in Southeast Michigan. So we share that with our partner organizations as well. So we're always assessing whether this is something that we can add, we can bring in more civil servant, or is this something that is for just 6 months and we have to, you know, be able to deploy, especially in this COVID response environment. So I just want to share that with you. And, you know, it's always an ongoing analysis and, you know, assessment that we do before we make these decisions.
Well, and that's why I appreciate that, and somehow correct. I mean, I've been following this for a long time. There's been, without sharing the analysis with people that sign off on this, like myself, there's always the suspicion of we're doing an end run around our employees. You know, so an analysis that shows these jobs will be for 6 months, or why you came to that decision, gives me a lot more comfort in terms of contracts like this. And to me, that gets shared up front. I mean, we're here today for a vote, right? And to say, well, we'll send you the analysis, you can see it next week or something, is a little late in the game, in my opinion. So I would like to see that analysis because that helps me. And, you know, if the analysis shows this is the way we have to go, then that's the way we have to go, given all the considerations. But sitting here today, I don't know that. But so is it possible to share that analysis?
I can definitely write exactly what I just shared with you verbally. And so I would like to ask you, when in this analysis that you're asking for, what are the key pieces that you're looking for to, other than, you know, potentially the funding is short term, we have to deploy services very, very quickly. We already have civil service staffing that are doing the managerial and supervisory. Is that what you're looking for in this analysis? I want to make sure I give you exactly what you're asking.
Well, it doesn't sound to me then like you have a white paper somewhere,
right?
six pages that shows the analysis.
Right.
You know, and that concerns me also. I understand, I'm following what you're saying, right? But when you're asking me what it is you want to see, here's my response. Send it to me. I can digest it, and then I can have questions.
Okay.
You know what I mean? But I can't, you know, right here, without some sort of an analysis about why we're doing it this way. I can't cover all the bases off the top of my head here. I'm trying to understand why we're going this way, and it's the analysis you've done which would explain that to me. So
Okay.
yeah, you know, and so I would like to see, I understand what you're saying, but I'd like to see it in writing. And then I would have questions.
Not a problem.
You know,
And
because
to that point, Commissioner, to
sure,
that point,
Sure.
just to clarify, was the first amendment, emergency procurement, the first, because this is the second amendment to this.
No, the first amendment, we submitted it in May. It was to add additional funding as well. And at that time, we added 6 million in funding. And this is all for response staffing. We also received some funding for our medical marijuana education grant program, and we added that to it. And as you can see, these are short-term grants that we get from the state that sometimes it's just additional funding that they have for a very short time. So we have to think strategically how we're going to deliver on this on behalf of the county, how we're going to serve the residents. And our biggest, assessment is that we need to get these services to the residents without compromising any of, displacing any of our staffing here. And we work, our culture here, we work very closely. When we work together as a team, we support one another, and it's a goal that we all work on together, be it civil service or a SEMHI employee. But I see where, your concern is. So this was not an emergency procurement. It was actually procured for 5 years.
Okay. Thank you.
Madam
Okay.
Chair?
Yes, go right ahead.
Thank you. Yeah. I'm following what you're saying, Ms. Baker, but I'm also looking at a way of doing business between an executive and a legislative body. This probably won't be the last time we go to SEMHA. And it seems to me there'd be a boilerplate kind of a analysis done that looks at our current workforce, looks at the duration of the money, and can put it in black and white. And that, and we've had the same discussion with our IT department. Given the way the industry is out there, we started using SEMHA 8-9 years ago pretty steadily in recruiting IT people here. And the same discussion came up when that was done. And any other future contracts with SEMHA, I will have the same questions when it comes. And so what I'm hoping is that an analysis of why we're going to use SEMHA for employees and why we're not going to hire, if necessary, county employees that can pay into the county retirement system, that can, so that is something I really want to see in the future. I don't know what we can do about it today. Are all of these 6 months, Ms. Baker?
The contract the funding was added to, yes. So for this, until this fiscal year, the end of this fiscal year.
And then the contract runs out, and whoever we brought on from SEMHA to perform these functions, we would be no longer paying come October 1.
Well, the assessment, the state, this is for a pandemic response.
Mm-hmm.
So, and that's been something that we had to really adjust to, because there's been additional funding. The state will articulate our needs. The state will say, hey, and they would then make funding available. So, as we can predict, the pandemic will be how we predict,
Right.
additional response funding that we get from the state.
Right. Another another wave and then another round of funding comes and we got to figure out how to spend it and put those services out there for the state.
Yeah, I serve our residents.
But what I'm suggesting here is that when we have SEMHA contracts, that analysis that we've been just verbally discussing come to us beforehand in writing. I may hear something different from county employees after this discussion. I'm not saying I will, but I may hear something different, just going on experience that I've heard in the past on other SEMHA, using SEMHA. So, like I say, I don't know what we can do today, but this is funding till the end of the fiscal year. Correct?
Yes. So I will put that right up together and share with you, Commissioner Colleen.
Well, I think all of the commissioners should see it, but I would appreciate that. So thank you, Madam Chair.
Thank you, Commissioner Colleen. Any other? I see Commissioner Marecki.
Thank you, Madam Chair. Carolyn, so you guys have to use this money within 6 months. The 12 million, the increase of $12 million. It seems like things have, I know there must still be centers where people are getting vaccines. How active are all those centers? I guess my question is, are we going to be able to spend $12 million in the next 6 months on COVID-related items? And is Guidehouse part of this monitoring all this money as well?
So to answer your question, we have budgeted very keenly, with the state, and we've actually articulated, that this is how we're going to use the funding.
Mm-hmm.
And so the state is aware of that. As far as you mentioned the sites, epidemiology and tracking of our data is an essential, it's a core function of what we do in public health. So we're always looking at operationally how we're doing at our testing sites, and balancing that with the changing in season, what's going on with vaccines and time and availability, as well as contractual relationships that we've also are into. So we put all of those together. And so we're just continuing to make those testing, these resources and services available to residents. And then sometimes we have these ebb and flow, sometimes we have increase in vaccination and testing, and sometimes we see lower numbers, but we're constantly looking at those numbers to assess, what else we need to do to support.
Yeah, or readjust.
Through the chair.
Yeah.
Finance Director Kamal Keparu for the department. You asked about Guidehouse.
Yes.
Guidehouse does assist us with all COVID-related grants. That was really their main focus with the influx of grants we getting for COVID, whether it's from the federal government or the state. Guidehouse is assisting with that. But the burden, as Ms. Baker is saying, for lack of a better term, one of the main issues is we're getting a lot of funding for COVID. We have to manage the eligibility, should I say, for lack of a better term, because if we get money from FEMA, we get money from the state. Sometimes the funding, the services, we do the same thing, right?
Right.
So it's a matter of allocating it in an appropriate way and then doing it expeditiously. So that's part of the issue. But to answer your question direct, Guidehouse does help with all our COVID-related grants.
Okay, well, that's good. It's good that they're there just to oversee, because nobody wants to violate anything if the money's coming from the feds to the state. And just one more question too. I guess I don't know that much about SEMHA, but I would assume that is advantageous for us, because these employees, we don't have to pay their benefits, do we? if we're working with this group?
When you say benefits, it's built into the contract with Simha?
It is?
So, yeah, so the funding, so the county, if Simha is the fiduciary, Simha built that into their benefits to their employee.
Oh, they do. Okay, with the money that we contract with.
Yeah.
Okay.
Yep.
All right. Thank you.
All right. Commissioner Colleen, did you have another question?
Yeah, if I may.
Mhm.
And no, Commissioner Marecki, they don't become county employees and they're not part of our retirement system and they don't have an AFSCME contract. And I think with all of this alphabet soup with Simha, it's not Simha. Does somebody on staff remember who we hired the IT people through? Was that Simca? Who did we use for that? The staff remember?
Yeah, I'm really not sure. I'd have to look it up.
Okay. Well, I'll get it later from you, Mr. Slezik. But okay. I just wanted to know it wasn't Simha. I just wanted to correct that. All right. Thanks, Madam Chair.
Okay. All right. Well, thank you, commissioners. So what we will do now is we will take a motion for both items 1 and 2, recommendation to move to the full board. Is there a motion?
Madam Chair, I will move these 2 items for a recommendation of approval to the full board.
Yeah. And that's items 2 and 3, and I support that.
Thank you. It's been moved and supported. All those in favor, roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Anderson. I don't think he ever joined. Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Right, the motion has been approved. And is there any abstentions or any opposition to the motion? And there are none. Motion passed. Next item, please.
F, such other matters as may be properly submitted before the committee.
All right, there's no other matters. Next item.
Public comments.
Are there any public comments? Please unmute everyone. And we will take public comments.
Everyone's unmuted.
Okay, and it appears that there are no public comments. Last time for public comments. There are none. All right, we will move to the next item.
Adjournment.
Is there a motion for adjournment?
So move, Madam Chair.
Is there support? I support. All right, meeting adjourned.
Thank you, Madam
Thank
Chair.
you. All right.